Hello, hello, hello. My name is Monica. I am a family nurse practitioner and I am the owner of Continuity of Direct Primary Care and Psychiatric Services. I am here today to welcome you to my channel and to talk to you about the importance of direct primary care. Direct primary care is a medical model that is nothing like your traditional medical model. So, the traditional medical model, you have your annual enrollment, you have your deductible that you have to meet before the plan starts paying anything. You have your premium that you pay monthly or every 2 weeks or so when it comes out of your paycheck. And then normally your company pays the other portion of it. There's also co-pays that you'll have to pay, whether it's to your primary care provider or if it's going to be to a specialist. That's traditional healthcare. That's the American way that it's been since I've known it. So direct primary care, which is what I offer. Direct primary care is not health insurance. It does well to cover gaps where health insurance lapses or does not cover. Direct primary care is membership-based model, which enhances the relationship between the provider and the patient, cuts out the middleman, and basically you pay a monthly membership fee and you have access to your provider. You have quicker access to appointments. You don't have to wait in line. Oh, put me on a cancellation list and nothing like that. Direct primary care, you call me, you can get seen the same day. You call me and the clinic closes in 30 minutes, but you can't be there for an hour. I'm here for an hour because I need to see what's going on. I need to know what's going on. You need me, I'm right there. Direct primary care, more affordable. So right now I have individual plans for college students and younger adults, $29 a month. If you need to see me 5 times in a month for an hour, 5 times a month for an hour, I'm right here. And that $29 covers all of the fees for that visit, for each one of those visits. So you pay $29 one time. I am also offering workforce solutions for an employer with 5 people. You want something that's more affordable? $300 a month covers either you and 4 employees, or it can cover 5 employees. What it does is helps you to be able to offer your employees something more. So let's say right now your current plan, you just hired someone on, but their benefits won't kick in for 60 days. But they have pre-existing conditions. They need to see somebody. They need medication refills. And they're just starting this job, so they don't have the money to go to urgent care. Definitely don't want the cost of an emergency room. So that's where direct primary care fills in the gap. So it's very good as far as a gap option. Another option that I'm offering at Continuity is an option for those who are under the threat of losing their Medicaid. And the reason I'm offering a select amount of plans, excuse me, to these people is because they already can't afford regular medical care. They can't afford to pay for it the way other Americans can. Maybe they're not working. Maybe they're, disabled some kind of way, but they're not permanently or, going to be long-term disabled. So I decided, well, let me throw in a couple of plans because it looks like this big, beautiful bill is going to go through. And if this many people are approaching hurricane season and FEMA's MIA, then they're going to need some kind of assistance. They're going to need help. So I decided, well, let's throw in a couple of plans. So we can verify your Medicaid coverage, and your Medicaid coverage is going to end. Then once your Medicaid coverage ends, you can pay $5 or $10 a month. And if you don't have it that month, then we have vouchers. That's another thing about direct primary care. As a business owner, I can use vouchers to decide to cover your medical cost so that you continue to see me, so that you can continue to get your medications filled, so that your voice can continue to be heard, because you want to live and you value your life. You still need preventative care. You still need medication management. So that's what direct primary care offers. A stronger relationship between you and your provider, affordable care, and you're still getting the same care. So you're still getting, if you need labs done, if you need diagnostics done, if you need referrals, you're still getting all of that, just at a substantially lower cost. So direct primary care, I encourage everybody, find a provider in your area and see if they're taking patients, so that you can at least have some kind of gap coverage or something in place. If you're on Medicaid, don't wait till the last minute. Be proactive and do something now to help yourself. Step out, run out ahead of this thing now. Even if you're not sure about it, go to our website. It's www.cdpcare.com, and reach out to us through the website and let me know what your story is. Let me know what's going on, what you think is going to happen, so that when it does happen, you'll have some type of option in place, or you'll have resources available so that you will know what your next step is. All right, well, thank you guys so much for viewing my video today. Like and subscribe and hit the little notification button. Thanks.